All right. Who are those good people at that last commercial? G.S. Regan, that's my firm. All right, so honestly, girls, you're doing a phenomenal job. The phones have been ringing off the hook. 757-1320. We have Peter Abare-Brown in the office. Studio, excuse me, I'm always in the office. I'm sometimes in the studio today. Director of the city's Human Resources Department. And I must say, he did a great job. The seminar was packed, so obviously it's something of interest to you, which is good. To my listeners, do not panic. This change is okay. I asked the question. It is a true Medicare supplement. Now remember, we are always in the market to help people. So if you don't know the difference, what a Medicare supplement is, you are coordinating with CMS, Centers for Medicare and Medicaid Services. CMS pays 80% of the bill. That's why you have a red, white, and blue card in your wallet. And the carrier pays 20. In this instance, I asked the question out loud. Cigna is the payer. They are primary. Medicare is only secondary in this situation. And the reason being is because of the size of the City of Waterbury's group. So if you're out there and you're not a retiree, you have two choices to make. You can either take a Medicare Advantage plan, which you've agreed to use the network of doctors, and they're not a scam. I sell a lot of them, and they are truly zero monthly premium. And then if you have a good amount of savings and you have several medical conditions, or you just do not want a network of doctors to use, you can buy what they call a Medicare supplement. Medicare supplements are obviously with United Healthcare, Anthem, Blue Cross Blue Shield. Those are the two I trust in the state of Connecticut for a supplement. For the Advantage plans, you're going to have a more plethora of choices. You're going to have United Healthcare, Anthem, Connecticut, Aetna. I'm not a humongous fan of WellCare. We actually don't sell any WellCare at my office. I don't like a van that parks on the green and preys on homeless people. Now, how can you do that, and why is that done? Because the government put in a subsidy called Medicaid. If you qualify for Medicaid, you can get a Silver Connect card, and everything is changeable on a monthly basis. So if I worked hard and put you in a plan and the van rolls up, they're going to get $127 commission for switching you into another plan. That's called churning. We're not supposed to do that. So Delta Dental, let's touch on that. It's an outstanding dental carrier. It's the largest independent dental carrier in the country. They're based out of Parsippany, New Jersey. I think Tina did a great job from Delta, representing Delta. It is not a bad thing. Anthem is an excellent dental carrier, but so is Delta. Call your dentist's office. Whatever the reimbursement rates, whether it would be 60-40, 50-50 on a crown, I believe the question was in the office, that will not change. So, lastly, the last initials Peter was going over is POE, point of entry. That's usually the most affordable care that is offered in a municipality, and the reason being is it's stripped down a little bit more. It's more of an HMO platform with, of course, emergency visits out of network, but you don't just have the out-of-network component. When you're out of network, you're either at a walk-in clinic or an emergency room, and it's in a need of time care. You don't just have the luxury of saying, well, I don't like the opinion of someone here. I'm going to go to New York on the POE. Remember, POE, point of entry. It's more of an HMO platform. POS, it's a HMO platform, but with point of service. It offers you the ability to go out of network. Also, another great question. Client in the back of the room, a gentleman standing, by the way, because it was standing room only, asked, is this managed care? This is health care. The term managed care gets thrown around too much. What managed care means usually is that you are on an Advantage plan, a managed care Advantage plan, and they specifically said, and Peter heard it as well, this is not an Advantage plan. This is a true med sup. So that's always nice to hear. Peter, go ahead, wrap up any questions, and then I'll move back to my show.
Well, I think in closing, I'd just like to say that keep in mind that the mayor is doing the right thing here. He's being fiscally responsible. It's something that had to be done. And although he's saving the city a significant amount of money here, your benefits are not going to change.
Well put.
And let me just say, we just went through the 3 different types of plans that we have. And whether you have the PPO or the POS or the POE, those are all excellent plans. It's just a personal decision which one you want to be in. But every
and
single
what you
one
want
of those,
to spend.
Yes, and what you want to spend.
They are. It's not Mickey Mouse, bottom of the barrel coverage. It's outstanding coverage. What is the copay? For the
copays currently, and copays are not tied to the third-party administrators. So keep that in mind. When we change the third-party administrator, your copays and your premium cost shares are not going to change. So your premium cost shares for active employees on the PPO is 20% of the premium equivalent. For the POS, it's 12.5%, and for the POE, it's 5%.
That's the incentive to take the POE.
Exactly, and the coverage is very, very good.
It's always comparable. It's just the right side of the column with the out-of-network. That's the difference.
Now, keep in mind those numbers are dictated by the collective bargaining agreement. So, to the extent that you're an active employee, those numbers are subject to change based upon collective bargaining with the city. But again, those numbers do not change due to the decision to change third-party administrators.
Right.
Now, as far as copays go, your copays remain the same. Depending on what your plan you're in, you probably pay a $20 copay to go see your physician, maybe a $25 copay for a specialist under the POE. That's not going to change. Your copays for urgent care or emergency room, which are $100, that's not going to change. Your copay for outpatient surgery, $200, that's not going to change. Your copays for inpatient hospitalization, $300, that is not going to change.
First of all, those are phenomenal benefits. $200 for outpatient surgery is unheard of these days. The lowest Cigna on a non-municipality platform, or Anthem is $500. That's the lowest threshold that it's been lowered to now. So out there, if you're working, be lucky that you have these great benefits. If you're a retiree, do not change plans. All right, let me explain that in nausea. A woman came in, beautiful woman, listens to the show. I know her daughter. Thanks for the referral, Cindy. She came in, and her husband is the retiree. He had credible coverage with Connecticut. So he's only secondary on the city. He can take a primary plan and let the city be secondary. But she is a city retiree. She cannot change. The gentleman from Columbia, the really intelligent guy, Al so-and-so.
Al Saavedra.
Al Saavedra. We try not to say last names, Peter, for reasons.
I apologize.
No worries. It's all right. It was fine. You're his boss now. Okay, so Al so-and-so, incredibly intelligent. He said to me, I went up to him after the seminar. I said, listen, I'm going to go on the air in a few minutes. I need to be right on this. Do not change. Annual election period, AEP, October 15th through December 7th, is only for non-retiree City of employees or the surrounding towns. I saw that in the letter here. It said, I understand that you and your families may have questions, so I'll be having seminars here, but anyone that lives in the surrounding towns, it did touch on that in the letter. Do not just call an insurance agent and say, oh, this is what they gave me. Don't. You'll lose it. And if you lose it, you cannot get it back. Is that correct, Peter?
That's correct.
All right, good. I'm spot on there.
As a retiree. That's
right.
Correct.
Do not change. Yes, I want your business. But Roland Trokey says to me all the time, and I'm allowed to use his name because he told me, you know what I like, Regan, is when you tell people to keep what they have. And I'm telling you right now, I want the sale, but keep what you have. All right? Please, if you lose it for good. This is a grandfathered-in plan. It's the term we use in insurance, which Peter didn't say. They're going to just map you over. Mapping is a form of taking your information and trading it to a new carrier. It's just going to be mapped over, just like when United Healthcare bought HealthNet. So with computers these days, it makes things quite easy. They're all hypertext markup language. HTML is just programs. You pull up your name, date of birth. That has all systems. You transfer it with a data file, and it goes right to the new carrier. Usually it's a Gene uses it all the time. Excel. It's an Excel format. But do not change when you get this letter. I have also told the City of Waterbury, if anyone wants to consult with me because they trust me after listening to me for 3 years, feel free to call the office at GS Regan, because I will tell you to stay where you are. I can look up your doctor on Cigna, no problem. Kristen and Angela are geniuses with the computer. They can actually be working and texting their friends on their iPhones, and it's unfortunately an epidemic, so I now let it go. Because they're productive employees. But it's so easy for the younger generation. If you don't want to call anyone, a woman said in the seminar, I don't have a computer. Call your daughter. Call your neighbor. Call Maureen at the dedicated. She's being paid, by the way. So do not feel you are burdening anyone. The city is reaching out to you at this time to let you know that they are here for you, that the change is inevitable. Sometimes that happens. For my listeners out there, pass the word on. Tell your friends to listen to the show. And I'm going to have producer Nick come into the middle of the show. And also, Peter, credit to you. You've had a great show with me. We're making a YouTube video for the City of Waterbury's website. If anyone doesn't feel like they want to come out, you just listen to producer Nick tell you how to go to the YouTube page. Rock it, kid. You're going to go to, and thanks, by the way, for Shakespeareans who watches my show. That guy did a great job. My buddy out there says, oh, yeah, I don't know why people, oh, we'll take a call. Go ahead. Producer Nick, you get in here. I'll take that call in the hot seat. Go ahead. Michael Regan.
Hello?
Yes, sir.
Michael, I got a question. I'm a retiree from the city. And recently I went to a doctor's appointment, had a procedure done, and I asked about if they took Cigna. They said yes. But the procedure I had done, they said Cigna does not pay for. Now, will that, because Anthem did it, will it be covered by Cigna now?
Peter?
Yeah, I don't know, but I'll say it again. Your benefits are not going to change. So if it was covered under Anthem, it's going to be covered under Cigna. Now, your doctor may be speaking about another Cigna plan, but our benefits are our benefits, and Cigna's obligation is to match our benefits.
And don't say your name on the air, but just call my staff, and I'll put you in with the claims people, and we'll make sure they coordinate with your physician to make sure that's going to happen.
Okay. Thank you very much.
My pleasure. All right, Producer Nick, you're going to take over. I'll take over the camera. All right, so this is how you're going to find us.
Hello, everybody. If you'd like to watch previous broadcasts of Medicare and You, let's say you missed a previous show and weren't able to listen to the radio 2 Wednesdays ago, you can watch previous broadcasts on the Internet on YouTube. Just go to your web browser and type in www.watr.com. And when WATR's website loads, at the bottom of the page is a big red YouTube icon. If you click it, it will take you to WATR's YouTube page. And you can watch previous broadcasts of Medicare and You from right there. Also, if you want to go to YouTube straight, you can go to www.youtube.com. And in the search box, search for Medicare and You, Michael Regan, WATR, and previous broadcasts listed by date will show up. Also, if you'd like to email the show, you can email Michael a question at WATR Medicare and You, all one word, at gmail.com.
Beautifully done. Kid doesn't even need the headphones. All right, so Peter Abare-Brown, HR Director. He's going to give you the phone number again. Please do not panic. The reason we're doing this, and I hope I can get you on at least one more time before July, the reason we're doing this is to be proactive instead of reactive. You are not getting kicked to the curb. Anyone is turning 65 in the next couple months, just give me a call. I'll have you come to the office, and I will inform you what your rights are as far as Medicare. And Peter, every Tuesday from 9 to 11.
Yes, for every Tuesday, 9 to 11. If you have any questions, you can call the mayor's office, ask for Maureen, 203-574-6712. And Mike, on behalf of the mayor and the City of Waterbury, I would like to thank you for this opportunity to speak to your audience directly about this important change.
Absolutely my pleasure. I'm honored, and I'm a helper. I hate people that stand by and criticize. Get in there and do something, right? Bureaucrats, stay at home. Worker bees, grab a shovel, as he would say. So, let's get out there, have a great day, maybe take a walk, and get some fresh air.